Hey there viewers, welcome to another informative video of Health Shots. Do you know WHO has dubbed glaucoma the second leading cause of blindness worldwide, and it accounts for more than 10 million visits to physicians annually. Still many of us are not even aware of it. Why? Glaucoma is often called the silent thief of our vision because the disease damages the optic nerve. That's the most crucial part of our eye since it carries information from the eye to the brain. So when this gets damaged, we lose our vision. But glaucoma isn't a single disease. It's a group of diseases that comes without any warning signs, and like slow poison, it gradually damages all the important optic nerve. Stick to the end of the video if you want to know glaucoma's causes, symptoms and prevention. Hit the subscribe button if you want more videos on eye health. Now let's get straight into the video. Glaucoma causes. According to the American Academy of Ophthalmology, by the age of 65, 1 in 3 Americans will develop a vision impairing disease, mainly glaucoma. While its exact cause is yet unknown, experts claim that the primary contributor to glaucoma is increased pressure on the eye. If not treated timely, it can cause complete blindness. Our eyes contain a liquid called aqueous humor. This fluid usually flows out of the eye via a mesh-like channel, but when this channel is blocked or our eye produces too much of this liquid, we develop glaucoma. Medical specialists are still unsure what causes this malfunctioning. It is most commonly inherited and passes from the parents to kids. Otherwise, a chemical or blunt injury to the eye, extreme eye infection, blocked vessel within the eye, and any inflammatory condition can cause glaucoma. What's worse is that it affects both eyes mainly. Key facts about glaucoma. Believe it or not, glaucoma is one of the most misunderstood diseases globally, and people don't even realize they may be affected. Unfortunately, around 10% of people who receive proper treatment still lose vision. Another bad news is that glaucoma is incurable. Well, that's understandable because it's impossible to regain lost vision, but it's possible to halt further loss of vision through medication or surgery. It is essential to understand that anyone can develop glaucoma from infant to elderly. However, older people are at an increased risk while babies may be born with it. In fact, 1 out of every 10,000 babies born in the US has glaucoma. Interestingly, young African Americans are particularly susceptible to it. Glaucoma risk factors. Some people are at high risk of developing glaucoma, such as those who have a family history of the disease, senior citizens, African Americans, Hispanics, Russians, Irish, Japanese, or people with diabetes, and people who experience poor blood circulation and migraines. Moreover, if you have suffered any eye injury or thinning of the optic nerve, or are farsighted or nearsighted, even then you will remain vulnerable to developing this vision snatcher. Catching glaucoma early is possible though. You should go through comprehensive dilated eye exams and make specific lifestyle changes, which we will discuss later in this video. Types of glaucoma. There are 2 main types of this dangerous disease. The first one is open-angle glaucoma, which is also its most common type. It is also called wide-angle glaucoma. In this condition, the eye's drain structure called the tubercular meshwork doesn't allow the fluid to flow out as it usually should. The second type is called angle closure glaucoma. It is common in Asia and is also known as narrow angle glaucoma. When this happens, our eyes stop draining fluid like they should because of the narrowing of drain space between your iris and cornea. This causes pressure buildup inside, leading to glaucoma. Glaucoma symptoms. Sadly, the most common form of glaucoma, which is open angle glaucoma, shows virtually no symptoms. You never feel any pain even when there is increased pressure on your eyes, but slowly vision loss begins. Firstly, it will be side vision, then peripheral, and it will continue until complete blindness occurs. By the time you detect it, significant vision is lost. So getting your eyes tested for glaucoma is the only way to protect your eyesight. Angle closure glaucoma symptoms usually are more prominent and causes damage faster. So how do you know you need to get your eye tested? If you see halos around lights, redness in your eye, feel pain in or around the eyes, your stomach remains upset or vomiting becomes frequent, and eye looks hazy, all of these symptoms indicate that it is time to see an eye doctor. Glaucoma treatment. There are several treatment options to cure glaucoma, depending on the stage it is diagnosed. Eye drops are prescribed at the earliest stage to lower fluid creation in your eyes or regulate its flow to lower your eye pressure. Oral medication like beta blocker is suggested to improve fluid drainage or slow down its creation in the eye. If you have open angle glaucoma, laser surgery is used to raise fluid flow from your eye slightly. To stop fluid blockage in angle closure glaucoma, procedures like trabeculoplasty and iridotomy are used. How to prevent glaucoma? You have got to make some necessary lifestyle changes to prevent glaucoma development, such as when going outdoors, throw in some quality sunglasses and make sure your kids have them on as well. Start adding green leafy veggies in your daily meals to lower the rate of macular degeneration, inflammation, and of course glaucoma susceptibility. Pay attention to your oral health and hygiene. Brush your teeth twice a day and visit your dentist regularly. If glaucoma runs in your family, get a dilated eye exam done at least once a year. The key to healthy eyes is a healthy body. So your weight should be in the middle of the spectrum. So that's all we have today for you guys. Please share your thoughts in the comment section and subscribe to the channel for more videos on eye health.